My name is Anna Lopes and I will present our work Development of Sleep Quality and Quality of Life in Patients with BPH, a prospective study before and after surgery. For many years, the treatment of BPH has been focused on improving flow rate and avoiding symptoms, with the surgery being the gold standard for the most advanced and severe cases. And between patients, it seems nocturia is the most bothersome symptom, interfering with the overall quality of life of the patient and also sleep quality. In fact, there are several studies that focus on this problem of sleep quality and LUTS. In theory, correcting the source of LUTS should not only increase the patient's overall sleep quality but also his quality of life. Thus, this study main goal is not only evaluate the development of sleep quality and quality of life in patients with BPH that are going to undergo surgery, but also to confirm if LUTS and sleep quality are in fact associated with each other. And for that, we select all patients with BPH scheduled for surgery, and we did questionnaires and uroflowmetry plus PVR measurements before and after surgery. For this work, our final sample was 24 patients. The COVID pandemic limited our samples, so we were far from the initially calculated sample size, but this study is ongoing and we're still collecting, and we will continue to collect the data in the coming years. As we can see looking at the table 1, there was not only an overall significant improvement of LUTS symptoms after surgery, which actually was expected, but also a significant improvement seen in the quality of sleep and in quality of life. And if we're comparing the difference between each pre-op value and its post-op counterpart, we can see that there was a significant difference. And we can see all patients had a Pittsburgh, Nocturia, and a PVR larger in the first moment of evaluation than in the second one. And this meaning that there was a decrease in the post-op values in these variables comparative to their pre-op counterparts. Although there was an overall improvement of all variables studied as previously showed, 37.5% of the patients still had a Pittsburgh score superior than 5 after surgery. And to further study the sample, it was then divided between those who had Pittsburgh score less than 5 and those who had a Pittsburgh score superior than 5 or equal to 5. When comparing the parameters values in the 15 patients with a normal quality of sleep with the 9 patients with a poor quality of sleep, the last ones had a higher IPSS, ICQ and KO, PVR, Nocturia, and a lower total sleep hours. That means not only were the 9 patients still sleeping badly after surgery, but they were also still reporting to have persistent blood symptoms. Finally, the difference between pre-op values and post-op values on those 9 patients was minor when compared to the others. By examining the graphs in the picture and the values in the table, we noticed that both variables, IPSS and Nocturia, obtained after surgery, presented a direct linear association with the Pittsburgh and ICQ and KO, while also showing an inverse linear association with the total sleep hours. And this means that when the IPSS score and Nocturia episodes increase, the Pittsburgh and ICQ and KO score tend to increase. At the same time, when the IPSS score and Nocturia episodes increase, the number of hours the patient slept per night tends to decrease. The present study showed that BPH surgery significantly improved not only LUTS symptoms but overall quality of life and sleep quality, with most of the variables presenting an improvement superior to 50%. And more importantly, we stress the fact that Pittsburgh and ICQ and KO score decrease, and which shows very significant improvement after surgery. And the incidence of a persistent poor sleep quality after surgery was higher at 37.5%, as I was told before. In these patients, however, IPSS, Nocturia, Kmax, and PVR were also higher than those of patients presenting a normal sleep quality after surgery. The difference between pre-op values and post-op values on these patients with poor sleep quality after surgery was minor when compared to the others, which may imply that insufficient improvement of LUTS with surgery leads to persistent poor sleep quality. While it was being majorly reported that the existence of sleep disturbance secondary to BPH could be explained mainly due to nocturia, the findings of the present study suggest that the presence of LUTS other than nocturia could also be a factor in the existence of poor sleep quality and should therefore be studied and evaluated. As it stands, based on these findings, it is reasonable to state that not only nocturia appears to be a factor in poor sleep quality, other LUTS symptoms may also be responsible for a decrease in sleep quality and overall quality of life. There must also be a common etiology underlying LUTS and poor sleep quality in patients with BPH. So this is our concluding message. The presence of low quality of sleep and quality of life are most likely associated with the presence of LUTS symptoms, including but not limiting to nocturia. And in addition to the standard assessment of urinary symptoms, evaluation of sleep quality and quality of life should become a common practice in patients presenting with BPH, and a factor for choosing the path of surgery instead of standard medication, for example. So thank you all for listening to me.